So far in this unit, we have extensively explored the importance of the validity and reliability of a diagnosis and the several factors that may influence this. We also know that classification systems tend to trade off between validity and reliability in order to maintain objectivity and a standardized process in the diagnosis of mental health issues. However, in order to provide effective treatment, understanding the cause of the disorder is important, but this is not as simple as we would like it to be. There are several theoretical approaches to understanding mental health issues, which then influence the treatment that is provided. While there are a few concerns in the field, treatment and therapy of mental health disorders or issues are evidence based. Extensive research is conducted before a specific treatment is approved and practiced with clients or patients. In this video, I'll be going over approaches and challenges to assessing the effectiveness of treatment. This will help you as we move forward into exploring different treatments and therapies. Before we dive into that, treatment refers to any intervention provided to clients diagnosed with a specific disorder. There are several types of treatment, okay, and can be administered in different formats, such as cognitive behavioral therapy, okay, that is the theoretical approach, and the different formats available of practicing it can be through individual therapy, group therapy, couples therapy, and even family therapy. Okay, so it really depends on the client's needs and also what would be most effective for them. Okay, and I think another important thing to say is therapy is not only available to people who are experiencing mental health disorders, but also mild to moderate concerns that we face in regular day to day life, right? So, for example, with stress, experiences with um, adjustment, and so on. Okay, so it is not just mental health disorders that have treatments available or therapies available to them. Okay, so there are three common methods of investigating the effectiveness of um, a treatment. Okay, these are randomized control trials, also known as RCTs, qualitative research studies, and also meta-analysis. So the first one is randomized control trials. Randomized control trials are experiments that follow the independent measures design, wherein participants are randomly allocated to different treatment conditions. Okay? One condition could involve the participants receiving a specific treatment, for example, CBT, and the other group, a control group, which receives no treatment, or the other group can be another treatment, such as serotonin reuptake inhibitors, which are antidepressants. Okay, so effectiveness is usually measured based on quantitative data through observable symptoms or responses in psychometric tools. Okay, RCTs tend to also control for extraneous variables to the best of the researcher's ability, and this ensures that the outcomes of the treatment are due to its own mechanisms, elements, and strategies instead of other variables that are in the environment or within the participants. One of the strengths of the RCT method is that one can make causal inferences on the effectiveness of the therapy as it directly compares one treatment with another treatment or one treatment with no treatment. Okay, so based on RCTs, we're able to establish that it is that treatment that is causing the improvements or changes in the client or the patient. Okay. The control over the extraneous variables also contributes to the validity of the results. So, internal validity, because it is able to control any possible extra variables that may influence its effectiveness. Okay, single blinding and double blinding can help minimize biases in RCTs. Okay, these biases could involve expectancy biases of participants or researcher biases so that they are able to push and support their own proposals for the effectiveness of a treatment. Okay, nonetheless, this isn't always possible. Single blinding and double blinding is not always possible. Okay, there are some treatments or some research designs that might be very obvious, okay, and wherein participants are able to figure out what kind of treatment that they might be receiving. One such example of not being able to do a double blinding is when comparing, let's say, for example, group therapy to another condition, right? Being in the group setting, discussing your concerns, it would give away the nature of the intervention. So, in that case, participants would be able to figure out the aim of the research, and that could result in demand characteristics. Okay, and that also means that double blinding is almost not possible in such a situation or in such conditions. Um, so, another concern with RCTs is that it is conducted in highly controlled settings that are artificial, okay? And also, the inclusion and exclusion criteria of RCTs is really strict. So, there is a lot of control over variables. And this is not really reflective or applicable to real life therapy, wherein there's an interaction of several different variables, okay? So, that then affects the extent to which RCT results can be applied to real life settings. Okay, it is organic and it is natural for there to be an interplay of several variables in therapy. Okay, there are some ethical concerns as well with RCTs. Random allocation of participants is not ethically possible, okay, in RCTs unless both the treatment conditions have had some kind of scientific or clinical backing in the community already. Okay, and this is usually the case. Before RCTs are conducted, there are other inductive approaches to a treatment that are conducted. Okay, and then RCTs are utilized. Also, if there isn't any scientific backing or even just the nature of RCTs themselves, if you're putting one group of participants in a condition that has no treatment, that could do more harm to the participants than good. Okay, especially if the participants are experiencing severe cases of depression, okay, or severe cases of any mental health issue for that case. And finally, informed consent is also often impossible because informing the participants completely about the aim and the nature of the treatment might give away too much information. Okay, so that could result in demand characteristics and biases. So, informed consent is limited when it comes to RCTs. So, the next method are qualitative research studies or qualitative methods. Okay, these studies focus on the subjective experiences of the clients, their own interpretations of the treatment, okay, and its effectiveness, and also their interpretations of what might have caused the changes that they are experiencing. Okay, and qualitative methods might also rely on expert opinions of practitioners who have already maybe tried the treatment on one participant and conducted a case study. Okay, so qualitative methods are more reflective of real life settings because it does not strictly control the inclusion and exclusion, and also the environment is usually more natural. Okay, these qualitative methods include interviews, focus groups, and observations, and usually are the first step into treating or sorry, investigating the effectiveness of a treatment. And it is an inductive method, okay? Um, so once these treatments are tested through qualitative methods based on the observations and reflections of either clinicians, practitioners, or participants, um, hypotheses and theories are established, okay, and then are tested through RCTs. So qualitative methods usually lead to RCT type research. Then there's the meta-analyses. These are usually the last phase before the approval of a treatment for practice. Okay, a meta-analysis is a statistical analysis of the body of research that exists on a certain treatment and its effectiveness. Okay, a combination of results from several different research papers are assessed. Okay, and based on the effectiveness through the combination, um, either the treatment is approved for practice or then is sent for further improvements. Okay, A meta-analysis is integral to establishing an understanding of the effectiveness of a treatment because a research in isolation is not sufficient to do that. There are far too many variables, far too many issues with operationalizations that influence a single research. So if I was to conduct on my own with a group of researchers a research on the effectiveness of CBT, my research on its own would not be enough to put CBT into practice. Okay, so some variables that influence single researchers are the age group of the participants, the culture of the participants, the number of years the therapist who is providing the treatment in the treatment groups has experience that would influence and the results, and also is there any follow-up that the researchers conduct with the participants following the treatment. Okay, is it a 3-month follow-up, is it a 6 months follow-up, or is there no follow-up at all? So all of these different factors influence researches in isolation. So what meta-analysis is able to do is look at all of these variables and consider them and then establish an understanding of effectiveness. Okay, so extremely important. And this hierarchy or this pyramid really does show and depict the process really well. Animal and lab studies are usually conducted when the intervention is medication. Okay, obviously they cannot go through talk therapy, but we look at more inductive methods or qualitative methods at the lower or the early stages of research. Okay, and once we have conducted these and have some kind of understanding or information, we're able to develop hypotheses and theories that are then tested through RCTs. Okay, and then when there is a sufficient body of research, we conduct meta-analysis of that specific treatment and its effectiveness. Okay, and like I said before, if there is sufficient data and findings suggesting that this treatment is effective, then it is approved for clinical practices. Okay, and guidelines are provided for practitioners or therapists to practice. Okay, if not, it goes into further improvement and further research. Okay, so we have looked at a few of the strengths and weaknesses or limitations of specific approaches, but there are some general challenges in testing the effectiveness of treatment. Okay, as mentioned earlier, therapy needs to be evidence-based. Okay, we don't just conduct therapy because I came up with a new idea today. We need to test it and retest it and then establish its effectiveness before it is put to practice. Okay, unfortunately, the testing of a therapy's effectiveness is not as straightforward as we'd like it to be. Treatment and therapy are interventions that are complex, and there are quite a few challenges that we face in establishing the effectiveness of it. First is the severity of the symptoms or the disorder. Okay, some treatments are more effective for mild cases of depression, while others are more appropriate for severe cases of depression. Okay, and the role of the client in the therapeutic process is significant. Okay, especially when the therapeutic interventions are talk therapies. Okay, with medication, it's a more passive process, but with talk therapies that involve CBT and other techniques or other approaches, the client plays an active role in the process of intervention. Okay, so having said that, then, if the client is experiencing severe depression, for example, finding motivation to talk through their problems might be a struggle when they're already kind of dealing with insomnia, really low mood, lack of motivation, and so on. So, in such a case where the symptoms are severe or the condition is severe, antidepressants might be more appropriate to first tackle these symptoms, okay, and bring the individual to a position where they are able to engage actively in other therapeutic approaches such as CBT. Okay, so then the next concern or challenge is with treatment outcomes and its operationalization. Okay, how a research operationalizes the outcome of a treatment influences our understanding of its effectiveness. Okay, so are we testing the reduction of observable symptoms that we had used to diagnose the disorder to begin with? Okay, are we testing immediate improvements or long-term improvements? Are we considering relapse rates? Are we assessing the subjective experience of the participants or the individuals? Or are we using psychometric tools to measure or score certain aspects such as depression or depressive mood, um, motivation, and so on? Okay, and an example of such a difference might be when comparing antidepressants with therapies like CBT. Um, Antidepressants tend to have a quicker effect in improving depressive symptoms, but have been found to have higher relapse rates, okay, as opposed to talk therapies that take longer to have an effect, but then have more enduring effects in the long run, okay? So then, if my research is focusing on short term outcomes, then it would be obvious that then antidepressants are more effective. Okay, so if you're not considering follow-ups and long-term effects, then we might be biased or into believing that antidepressants are more effective than CBT. Okay, so the way that the outcomes of a treatment are tested and operationalized does influence how we understand effectiveness of a therapy or a treatment. Okay, a question then that often goes unanswered, especially in RCTs, is what is the exact mechanism of change or improvement? Okay. Is it due to the client therapist relationship, the motivation of the client to improve, the mere releasing of emotions, or the techniques that are specific to a therapeutic approach, okay, that is causing the improvement or change? There have been several researches that have controlled for some of these variables and found that the approach in itself isn't what is causing the improvements. Rather, other factors such as motivation of the participant, the client therapist, working alliance, and so on. Okay. One method that has been used to understand which of these elements or which of the specific therapeutic element are responsible for the effectiveness of the treatment is the dismantling design. Okay, this design basically removes the active ingredients of a therapeutic intervention. So, for example, if it's CBT that we're testing, cognitive reconstruction is one therapeutic technique that is used. So, what this method would do then is remove cognitive reconstruction, okay, as a technique and test it individually and compare it to the full therapeutic process of CBT, which would then involve other techniques. Okay, so if this technique in isolation is able to provide similar results or better results than the full therapeutic process, then we're able to establish that it is this specific element or this specific technique that is what helps that therapeutic process to be effective. Okay, and finally, there's the placebo effect. A lot of researchers compare the treatment condition to a control group that receives no treatment. Okay, so some studies have been able to establish that therapy and treatments are more advantages to the control group. Okay, while others have not been able to establish that. So the placebo effect may be responsible for the lack of significant differences. Okay, and it isn't possible to dismiss having control groups altogether because in real life situations, just the mere act of seeking support might improve a person's situation. Okay, so the placebo effect is also possible in real life situations and not just in research conditions or experiments. Okay, so the placebo effect is almost inevitable, and it is important to compare the therapeutic intervention to a control group that receives no intervention. Okay, so this video basically introduces you to common methods and challenges faced when testing the effectiveness of treatment. We will be diving deep into different therapeutic approaches, so use your understanding from this video to understand research of that specific treatment, okay, and also to evaluate the researches that you use to support or contradict the use of a specific treatment.